Live, the morning show from CBS Local 2.
Good morning. Today is Monday, September 17th. I'm Jennifer Daniels.
And I'm Tom Tucker. Great to have you with us.
We are joined today by Dr. Timothy Joshin, a local dermatologist, and he's here to talk about different acne treatments for teens because we know, at least especially in my household, this is a big topic of conversation. And Doctor, I want you to clear up the myths, if you will, because my children were very active. They got online and tried to find out what caused the acne and what are the best treatments for it. And so tell me, what are these children finding out and what's the truth behind the root of all the evil behind acne?
Well, the real cause of acne is the fact that in teenage years, hormones start to flare up. And what that leads to is sticky skin, which plugs the pore. And so that oil that's supposed to be secreted out onto the skin gets plugged up and starts to build up underneath the skin. And then bacteria loves to eat that stuff. So then you get the inflammation, and then when the contents of that get spilled into the skin, then you get the really bad inflammation.
Now, at what point should a parent say, okay, this isn't just going to take care of itself with over-the-counter treatments? At what point does a parent say, okay, it's time to see Dr. Joshin?
Well, you know, I'm really a big fan of having people come in early on for acne. And the reason for that is this is an inflammatory condition which can lead to acne scarring. And scarring is extremely difficult to treat, and it's also very emotionally difficult for people to deal with, especially teenagers.
Now, is there a difference between girls and boys as far as acne? I mean, does one work differently than the other, or is it all one big clump?
It's really just one big clump. Yes.
Now, as far as over-the-counter treatments, because as I said, we want to know when we come to see you, do any of those do harm? Because they see all these celebrities that are using these, like Proactiv and all. Is that just delaying the inevitable?
Well, it really depends on the type of acne you have. So, for example, some people have very mild acne, and so the over-the-counter medications will work very effectively. But still, they're over-the-counter medications. Dermatologists have access to prescription-grade products, which are much more dramatic in terms of the results that you're going to get. And especially when you get into more severe type acne that can lead to scarring, you want to come in and get treatments like Accutane. Now, Accutane may get a lot of bad press, but the reality is this drug has been around for years and years and years, and it can cure acne in 70% of the time, in 70% of cases.
I wanted to ask you about that because I was under the impression that they didn't even prescribe it anymore. I thought that all that was prescribed still was the old standby tetracycline or forms of it.
No, actually we have newer forms that are combination products which make it easier for teenagers to use because instead of using 3 or 4 creams, they have to use 1 or 2. But Accutane is still around and it's still a miracle. To me, it's one of the best drugs that was ever made for the treatment of skin.
Can we show some pictures of before and after? Is this with using Accutane?
I think we do have some pictures here.
Yeah,
Hopefully
we do. I don't know. Can you see those there?
Oh, there we go. Now, this is a picture of acne scarring that we're seeing right now. And the great thing about being a cosmetic dermatologist is that we can help to treat acne scars as well. And you can see here some dramatic improvement in acne scars from a combination of therapy. Now, it's not easy to treat acne scarring, but with the technology we have today with lasers and fillers and things like that, we can really see dramatic results.
Is it safe to use fillers, though, in children?
Well, fillers are naturally occurring in our skin. We have hyaluronic acid, which is naturally occurring there in your skin. So it's very safe to use for teenagers.
And now you said the lasers are also another treatment that can be used as far as, well, getting rid of the scarring, but just actually treating the acne itself. You recommend Accutane, and then what else? There's obviously a topical because you have to treat it from the inside out as well, correct?
Exactly, exactly. So what we do is we really customize treatment based on the type of acne a person has. So for example, if they have mild acne with just blackheads, whiteheads, what we'll do is we'll do extractions and we'll do things like Retin-A. And Retin-A will help to exfoliate the skin and allow the pore to function more normally. And then for more intense acne, we'll do antibiotics. products, such as either topical or oral. And if it's really bad, what we can do is we can do it orally to help fight off that inflammation. And again, as I said, I'm a huge fan of Accutane. In Hollywood, they're using Accutane for movie stars that have just mild acne now, because it really is a wonder drug that will take away acne. And then for people who are not able to tolerate Accutane, what we have is we have these laser treatments that will also help to fight acne, either based on killing the bacteria or cutting down on inflammation, or actually changing the structure of the oil gland, which is actually the root cause of acne.
Okay, doctor, any last words to parents that are dealing with this at home? Give us our last bit of advice.
Last bit of advice is just come in and treat it. Don't rely exclusively on over-the-counter medications and wait until it's too late, because once your teenager has scarring, it's forever, and it's very difficult to manage.
Okay, thank you very much, Dr. Timothy Joshin, dermatologist, and you've given us some great words for wisdom. We'll be right back.